Bismillah. Thank you very much for having me and for this nice talk about the special part of the world in special time. Gaza is not like any part of the world. It is under siege for several decades, as we know, and also the medical supply to Gaza must be imported because they don't have factories, they don't have companies, they don't have medical supply like anywhere in the world. And also, access to Gaza is different from any part of the world. You have to go through either Egypt or through the occupied part and Jordan. So Gaza is when I went there. Middle of March, it was the European hospital was still working. At the moment, they ordered them to evacuate the European hospital, and when I was there, the European hospital was the only working major hospital in Gaza because they were attacking the Shifa hospital, and it was the last attack. And the Shifa hospital, it was out of order after this
That was
attack.
that was in Gaza City.
In Gaza City, yes.
Same.
Yeah, and Nasser, it was under siege at that time, and they were attacking the region of Nasser. So Nasser, it wasn't working when I was there. As far as I know, in Gaza, they have like 33 hospitals, but it is not a hospital. They have only three major hospitals, Al-Shifa, Nasser, and European Hospital. The rest of the hospitals are small hospitals for like first aids. Like I saw a Najjar hospital in Rafah, and it is a small one. You can't do surgery in this part. There is a Kuwaiti hospital and a Jordanian hospital, Turkish hospital, and Indonesian hospital, but these are very small. You can't do surgeries. I'm an orthopedic consultant, so I dealt with like unique type of injuries. And also, we got shocked from the number of injuries coming to the hospital every day. So as maybe you are following the news, and you are you know how many people injured every day. Like yesterday was 22, and when they attacked the Nusayrat, it was 270 injured in one day. I'm working in a major hospital here in Ireland, and if we receive two or three patients polytrauma, like what we saw in Gaza, the hospital will get busy, and it will be like top emergency in the whole hospital. Imagine you are receiving this huge number on daily basis in Gaza to one hospital with lack of medical supply, lack of instruments, and also the availability of the theater room there. Not like here, the theater rooms in European hospitals, only four theater rooms in the main theater, and one for eye surgery, and one in the ground floor for neurosurgery. Imagine this number. You are receiving more than 20 or 30 patients injured in a war, polytrauma patients, and you have only four theater rooms. How can you manage like this? And also, as I mentioned, there in Gaza, there is no medical supply. So you have to carry everything with you. And this is not an easy job. You have to go through Egypt and then across Rafah. So sometimes they can allow you, sometimes they advise you to return it back to Egypt. So it is not an easy job to carry these items with you. And as we know, the types of injuries in the war, most of it is open fracture, means the skin is damaged and the bone is exposed to the external environment. And this is a top emergency in orthopedic. If we receive patient like this here, we should deal with the patient straight away with multitask teams like plastic, orthopedic, sometimes vascular, and like many teams will deal with the patients. But in Gaza, you are in your own sometimes because everyone is busy with his some cases. So you have to manage. And when I went to Gaza, we got shocked from the environment inside the hospital. Like people were living there everywhere in the hospital, in the corridors, on the stairs, everywhere. And as far as I knew, it was 30,000 in the region of the European hospital. So tents everywhere in the hospital. Number of patients in the room was too much, like four bedded rooms. You can see nine or sometimes 12 patients in the hospital, plus the relatives who is staying with the patient. So, and this if you see this, you will get concerned about the safety of the patient, because if the number of personnel in the room increase, this increase the risk of infection. And you are dealing with special cases. It is open fracture, so the risk of infection is there. It is high. And also it is high velocity, or it is high energy trauma. This means the soft tissue damage is massive. So this increase also the risk of infection. So like those patients, if anywhere in the world, it should be treated in highly specialized centers. But unfortunately in Gaza, you don't have choice. You have to deal with the patients, and you have to save them as much as you can. Most of my patients in Gaza were women and children, like 70% women and children, and 30% only were men. So, and most of them get injured while they are in their houses. So they are innocent people. I didn't see any patient or any injured patient came while he was fighting. I didn't see something like this. But most of patients came from their home. Sometimes they get direct shot from the drones. The drones, imagine, it can shot direct to some person. It has cameras, it has weapons. So someone sitting in his office in the occupied part of Palestine, and he decided to shoot this person just to press on the button, and it
يعني
can kill.
sorry for
We saw
interruption.
only.
Sorry for interruption, Dr. Shaalan, but
Yes.
what I can understand from what you're saying, that almost all the cases which you have seen in Gaza was people, really civilians, not
Yes.
you haven't seen any kind of military clashes, injured from a military offense or military kind of exchange of fire or something.
No, no, I didn't see anyone like this. As I told you, according to my statistics and the people I did operation on them, 70% of them either children or women. So, and the 30% are men, and they came from their houses. There's no signs those people came from the fighting field. They came from their own houses. And also, people there are too much exhausted because they are displaced from one place to another place. And once they start to settle down in one place, they ask them to move to another place. Also, the availability of food there, it is there is a big lack of food for patients, for normal
Even
people,
for the
even.
medical crew as well.
Yes, for everyone. Like what we got there when we were there, just rice with little piece of meat, and we told them we are not coming here to sleep or eat. We are coming to work. And to be honest with you, I stayed there 2.5 weeks, and I lost nearly 9 kilograms from my weight when I was in Gaza. But this is not the main issue. Imagine we are visiting for few days, and we lost this amount of weight.
Yes,
Imagine how the
this
people
number
there, and also
of kilograms
availability
is so.
of clean water there. It is very hard, and also availability of toilets and personal hygiene. It is not there at all. So it is hard the
Yeah, it's a good
situation,
example
especially
that
people are
you are
exhausted.
mentioning about the people there, that you yourself, Dr. Shalan, lost something like 9 kilograms in just something like 20 days or less. So imagine people who are suffering the same situation for something like 9 months. So imagine how is that. It gives a real picture of what's happening inside this. Dr. Shalan, thank you very much for your
Thank you. I just
t-
a few words.
go
Now
ahead.
it is more worse at the moment because Rafah border is closed for more than 10 weeks now, And I supposed to be again in Gaza last May, but we didn't get access after invasion of Rafah, and all the medical supply is cut at the moment. All the food supply is cut at the moment. So people there are in very bad situation. As I mentioned, the European hospital now is not working. Most of the staff, I am in touch with them. They moved to Nasser Hospital, and Nasser Hospital was attacked when I was there. So it is not working in full capacity. So yeah, they told me they don't have like plates, screws, or nails to fix the fracture. They don't have
What you
even
want
the
to say
drapes,
that
the drapes to cover
what
to use
happened
it for
during
surgery.
your stay there in last March, what you gave us, the picture you gave us, and what's happening there is much worse after the
More
closure.
worse, yes, definitely, yes,
Yeah,
yes.
so hopefully this situation will improve. Thank you very much, Dr. Shalan, for your
No
testimony,
problem. Thank you.
for being with us.